Being worried that you might have dementia, being worried that you might have Alzheimer's can be pretty scary. And a common response people have is, I don't want to know, there's nothing that you can do anyway. I disagree.
Mr. Brown?
Yeah.
Hi, I'm Dr. Karlawish.
Hello.
Welcome to the Penn Memory Center.
On November 16th, 2023, the first patient at Penn Medicine received Lecanemab, and with that, we began to slow down the pace of Alzheimer's disease with the drug. Lecanemab is a big breakthrough and a very promising advance in the treatment of Alzheimer's disease. It targets one of the causes of Alzheimer's disease, namely beta-amyloid plaques, removes them, and through mechanisms that we're still discovering, changes the rate of decline, changes the natural history of the disease.
Tell me a little bit more about memory problems. What are you noticing?
For someone taking Lecanemab, the benefits aren't immediately apparent as if you removed pain from, say, arthritis. Instead, what you're doing is slowing down the rate of change. Persons on the drug compared to persons on placebo had a slower rate of decline on measures of cognition, measures of function. They're getting more time, if you will, at the stage of disease that they're at.
And one at a time, I'd like you to tell me the name of each object.
Okay. Tennis racket.
Yeah.
Lecanemab is a complicated drug, and so the steps from the decision to want to take it to receiving the first infusion are several. It begins with education. Penn Memory Center has assembled a host of educational materials for patients and families to decide, is this the right drug for me? The next step is to determine whether the person meets the criteria of clinical severity of clinical condition, namely either mild cognitive impairment or very mild Alzheimer's or mild stage disease. The next steps are to figure out whether the drug is going to be effective and safe for that individual. So that involves some testing. Testing for beta-amyloid, which is what the drug targets, so we have to confirm that that's present. Performing an MRI of the brain to assess for small bleeds in the brain, which can inform what someone's risk of having more of those bleeds are. And then genetic testing to determine more specifically what an individual's risk is of having some of those side effects or swelling. With all that data together, we can tell a person whether this drug is indicated for them, and if it is, what their risk is of the side effects. After all that's done, then the final decision's made whether to proceed. The big challenge with Lecanemab is we've gone from having really no treatments like it to now having this treatment. And so we've had to scale up our clinical operation to be able to deliver the drug to meet the demand. However, we've known for over several decades that the risk of developing dementia has been slowed down. Why? There's good evidence that shows good cardiovascular health isn't just good for the heart, it's good for the brain. And so a heart-healthy way of living is associated with reducing your risk of developing dementia. Even if you might not be able to take a drug to treat your disease, there are things you can do to help make sense of your symptoms, figure out how to live well with them, and how to live well with other people who are around you as you have these symptoms.